Hey, it's Chris with Overdenture Laboratory, and today we're discussing full arch workflows, and I want to introduce to you the Ultimate Restorative Protocol Guide. Now, this is a guide we put together that covers all of the different options for your restorative workflows and how to get your patient into their final full arch restoration. And then it also covers the different patient scenarios as to how they could walk into your office, whether it's at implant level, multi-unit abutment level, or if they're walking with a temporary prosthesis ready to transition into their printed try-in or prototype and then final. Today, we are going to talk about the overdenture to fixed option. So you have a patient in overdenture and they're sick of it kind of moving around and they want something a little less bulky, so you want to get them into a fixed prosthesis on multi-unit abutments. Well, how do we do that? Of course, this book is going to tell you everything. It kind of explains the patient scenario and where we're going to go from it. We need to get them at multi-unit abutment level and then start taking records from there. So on the next page, it kind of goes through the whole workflow as to what we're looking for to get that patient into their printed try-in or prototype for their final and then ultimately in the final. So what this kind of looks like is they're wearing their overdenture. They're going to remove the overdenture and then get the patient at implant level, whether it's removing a bar or removing the locator attachments. And then next, we want to fabricate a new denture for you to convert and get it fixed on multi-unit abutments. Then we also need to decide what multi-unit abutments to use, whether it's a 0, 17, or 30 degree. We can help you with that, or if you want to go through that process yourself, great, but we just need to get them at multi-unit level and a new denture. So remove what they're wearing, you do a reline of that denture, and then you're going to seat that. Make sure it fits nice and snug. And then if you have an intraoral scanner, take a 360 degree of that relined denture. If you don't have the intraoral scanner, then just do a flask of the denture. So we need to duplicate this denture again, because we want to make you a new one to convert to make it fix. We also, at this same appointment, we either want to have an implant level impression if you want the lab to decide the ideal angulation for your multi-unit abutments, again, 0, 17, 30 to get that ideal screw access hole. If you have multi-units on hand and you want to go through that process to figure out what's the best, you can take a multi-unit abutment level impression. Give us an opposing and a bite as well. Send all those records to the lab. Your next appointment is going to be a brand new denture to convert. And then we're going to tell you what multi-unit abutments to seat and where, or they'll already be seated. But at this point now, you're going to perform a denture conversion. And of course, that's in this book as well. But really what it entails, you have the new denture, you get the patient at multi-unit abutment level, you do a reline of that denture to see exactly where the multi-units are. Drill some holes in the denture itself, and then you're going to pick up temporary cylinders in that denture. And then from there, you're going to have to backfill the denture with acrylic, cut it back, get rid of the phalanges, and make it ready for delivery. Now, you're going to send the patient home in this they're brand new, fixed temporary prosthesis, because again, we're trying to get to the printed try-in phase and then into final. But they wear this for a few weeks, get them comfortable in their bite, make sure it's good lip support, and then from there, they'll come back and you'll take some new records to get them into their printed try-in. New records can be analog with a flasking technique, which again is also in this book, or we have a digital workflow called the iJig. It's a patented process that allows you to take some digital records and get them into a printed try-in. So again, either way, there's multiple ways to get to that final, and that's just one of them, going from your overdenture to fixed and then into printed try-in and then final. So again, this is available on our website. There's an ebook you can download. We can send you a physical copy as well. Please follow us on our socials. If you have any questions, give us a shout, and we'd love to work with you on your next full arch case. Thank you.